I'm Jeannie Rosner. I think I know pretty much everybody here. The few that I didn't know, I introduced myself. So I am the founder and the person behind Soul Food Salon, where my hope and my goal is to educate and empower us all to live healthier lives. I'm on a journey to do that, and I'm hoping that you all will come with me. I think you are coming with me on that journey to learn. And so there are monthly events. Many of our events have been recorded. We are recording today's event. It will be up on our YouTube channel. It's at Soul Food Salon, all one word. I'm pretty active mainly on the social media platform Instagram. I would love it if you'd follow me. It's at Soul Food Salon. I would love if you share it with others. My hope again is to inspire us all to live healthier lives. I present recipes and evidence-based science. So yeah, follow along. It's pretty fun. It's a fun platform. So each year I partner with a different nonprofit. And I realize, hopefully y'all realize you don't make any form of payment to come to these events. So I hope that you would perhaps help me in supporting that nonprofit. This year our nonprofit is called Eat Real. And they basically go into school districts and they do like a certification, like a LEED certification, similar to the green architecture. So they do Eat Real certification where they go in and they help remove abundance of sugar and trans fat and in their food in the cafeteria, and then they help them get access to better sourced meats, for example, like that are regeneratively grown farming. And so we are helping the Morgan Hill School District to get Eat Real certified. They basically will be able to touch 500 schools in California, and that amounts to like millions of lunches in the year. So it's really, I think it has a real big impact. They're just a great organization. You can go to my website, soulfoodsalon.com. In the main page, in the middle, the About section, it's very clear, like, donate here. So you can go on that and click on that. I would love it if you guys would help me. So far, we've raised about $3,000. My goal is to raise about $20,000. So we're pretty short of that goal. So, all right, so today I have the pleasure to introduce to us Carolina Corey. She's a medical doctor and also has a master's in public health. She's board certified in sleep medicine, pediatric pulmonary medicine, and pediatrics. She's currently a clinical associate professor at Stanford Children's Health, and she's a sleep expert, and she's going to share with us all the ways that we can sleep better and why sleep health is important. Thank you.
Thank you for having me. And I always like to tell people too, even though I'm at a children's hospital, sleep medicine is actually unique where you're certified in both adult and pediatrics. So I promise I also can see adults too. So during the salon we'll just review some basic sleep principles. So I always think it's good to have a bit of a foundation for what we're about to talk about. Talk about insomnia, because I know that's really the focus. I could talk about sleep for hours, but I'm going to focus on just insomnia. And then some tips to prevent insomnia and just like some tips to help your own health. I completely agree with this idea of the journey, because I feel like I'm on my own health journey too, going through all this training. Ironically, as a doctor, I feel like you kind of put aside your health in order to become a doctor for a while. And then now, as I was joking earlier, my brain thinks I'm 25, my body is telling me otherwise. So I'm realizing like, oh, I actually need to take care of myself too. So I love the whole mission that Jeannie is doing. This is wonderful. So just real quick, what is normal sleep? I just like this to show that sleep is actually, we're in cycles, right? So a lot of times people think you just fall asleep and then you just stay asleep all night and then you wake up and that's normal. But really, actually, you go through these different cycles. So this is an example of like what's called a hypnogram. You may see it on a sleep tracker if you happen to be one of those. So this is kind of what sleep doctors look at too. So you see that you get some light sleep, goes to some deeper sleep, you have a little dream, you go to light sleep, you deep sleep, you wake up a little bit, you go back to sleep. You kind of actually have, you cycle through these. It's actually normal to wake up a few times in the middle of the night. A lot of people think like, oh, really? So, a couple times it's normal. Usually it's so short that you don't remember it, or it's so short that doesn't bother you. So that's typical. And so you usually have more deep sleep in the beginning of the night, more dream sleep at the later part of the night. And the interesting thing is your brain will actually tend to also, if you tend to wake up early and you keep missing out on like rapid eye movement sleep, your brain will eventually be like, all right, I'm going to snatch as much as possible. So our bodies are really good at like seeing, well, you're not giving me what I need, so I'm going to just try to make sure I grab more of it. So sometimes your sleep architecture can change based on the sleep that you're getting.
Can I ask you a question?
Yeah.
Is there a particular part of the sleep cycle where memory is? Like, because I know that, like, is it when we're in the deeper sleep? Is it REM
Great question. Yeah, a lot of people ask like, well, which is the most important kind of as people, which is the most restful, which is the one that consolidates your memories, does all that great stuff. So the answer is kind of all of it, to be honest. You actually need the cycle, but the thought is really deep sleep or N3 sleep and rapid eye movement sleep are the two that are really thought to be the most restorative and actually help with your memory consolidation. So if you keep robbing yourself of, for instance, dream sleep, then you actually tend to have more experiences of like memory loss and those kinds of things. So yeah, and to kind of to tell the truth, a lot of people think when you're dreaming that's deep sleep. It's actually not. It's interesting. For those of you who have children, so people say sleep like a baby. We all know babies don't sleep that well. It's actually sleep like a 7-year-old, right? So you have a kid who falls asleep on the couch, and you can pick them up, take them to the room, dump them on their bed, and they stay asleep the whole time, right? That's sleep we all want, right? That's actually deep sleep. And then dream sleep is actually where your brain is like really active, and it's actually really easy to wake up from a dream. So just to clarify the differences a little bit. So what does sleep do for us? Why even bother with it, right? I laugh as an undergrad. You know, I was pre-med, I was a little intense. I thought all-nighters were like a mark, badge of honor. Looking back, they probably would have done better in chemistry if I had slept more. So sleep restores our bone, our muscle, it regulates our immune system, it decreases inflammation, which we really, I think, are finding as kind of the marker of like all kind of disease and aging and problems, it's inflammation. So actually if you sleep better, you actually decrease your inflammation. It regulates our stress response and consolidates our memories and learning, as we talked about, and reduces our risk of depression, anxiety, all these things. I mean, really important nowadays. It helps your glucose regulation and really just optimizes your life. So sleep does all these great things. So I always think it's like, it's all of these things, right? It's getting sunshine, it's meditating, it's hanging out with friends, it's eating well, but sleep really should be a part of what we're doing here. Sleep is a stress buster too, so I think a few people, if you're like me, it's been a little stressful lately, right? So it's another key component in all these different things, so quality sleep, balanced nutrition. So I just like to highlight, it's really important just to kind of help you feel better and deal with all the things that we're all dealing with. So what does a sleep-deprived brain feel like? I think a lot of us already know, but just to, it makes everything just seems harder, right? Or a little bit crankier, or not you, but people you know, right? Right, are a little more irritable when they don't sleep well, right? And you also have a harder time distinguishing like rewards and incentives. So this is when like low rewards bring joy in the hospital. Jeannie will know this. There'll always be some random donut sitting in some nurse's station. No one knows who brought it or how long it's been there. But when you're sleep deprived, you will eat it. And you will think it's great. And you don't really know why. And I always tell people, so I actually tell trainees, if that's what you're wanting to eat, you're probably sleep deprived. So, and I'm guilty. I've totally done this myself. Also, it's like even how you get neutral stimuli and how you interpret it. So here you have a friend, you're telling them a story. You're pretty well slept. You're like, oh, my friend's just listening carefully to my story. Maybe you're a little bit more sleepy. Okay, my friend's only pretending to listen to me. Maybe you're a little sleepier. Okay, she's getting bored. My friend hates me, right? So I say this like as kind of a joke, but it's true, right? So if you feel like, oh, everyone's against me today, just take a moment and be like, I could also be sleep deprived or just not feeling my best. So just to kind of be aware of how we take in even neutral stimuli when we're sleepy. And then I do this as just a caution that our brain, again, will protect itself if you're not going to do it for it. So if it senses like, hey, we haven't slept in days and hours, I need to sleep. So this is where if you feel drowsy, really telling people you can have something called micro sleeps. I don't know if anyone's experienced these, but yeah, it's where you feel like you're driving, or you're just doing something and you actually have this quick moment of like, I fell asleep for a brief moment. So one of the big things that all sleep doctors really say is don't drive when drowsy. So as much as you can, if you find yourself drowsy, pull on the side of the road, take a quick nap. So as a doctor, we do call shifts, and I always tell the residents like, take a nap before you go home if it's been a long night. So just, a lot of people ask like, how many hours of sleep am I supposed to have? So this is just showing this is the National Sleep Foundation recommendation. So as we get older, we need less, but this is just showing for a typical adult between 7 to 9 hours. For older adults, 7 to 8. I'm just curious, and I just always like to take a quick survey of the room. Like, how many people feel like 7 hours is their ideal time? Okay. How many people feel like 8 hours? Okay. How about 9? Okay. Anyone greater than like 10?
Well, right now, since I get no sleep, like 12 hours would be awesome.
We have a 12 hour. But it's important to show that there is a range. There's some people who actually, I didn't ask about 6, there's some people who actually feel like they only need 6 hours of sleep. It is possible, there are short sleepers that exist, but there are fewer than many think there are. So if you're someone who's like, oh, I only need 6 hours of sleep, but then on weekends or holidays you sleep about 14, you're just sleep deprived. So it's important to know, like, what is your ideal? So a little bit of the sleep-wake cycle, and this is important as we understand insomnia and think about it. So all throughout the day, we actually have this circadian rhythm that kind of oscillates our wake drive. So, and then when you first wake up in the morning, you feel more awake. Maybe in the later morning, you feel like you're most primed, and then that time after lunch, you kind of feel like drowsy again. And then in the evening, maybe you like feel awake again, and then you kind of, so does that sound familiar? People are like, oh yeah. So this is just, you have your wake drive that kind of oscillates throughout the day. Now you have something called a sleep drive, which is always linearly going up. So everyone in this room is sleepier now than you were when we started. So it's just you're constantly sleepy every single moment. And it's because you have something called, so you have adenosine, which is like a byproduct of ATP, which is just something that your brain uses for energy, and it breaks it up, and it accumulates in your brain. So the more of it that you have, the sleepier you are, and you're always building it up. And so the greatest distance between where your sleep drive kind of gets its max, right? We have the highest build of adenosine, and your wake drive is actually kind of also at its lowest. When you have like the greatest distance, you fall asleep, right? Sounds easy enough. It's pretty elegant. Of course, when you have insomnia, it doesn't match up, right? So you can be really tired, but then your wake is really high too. So then you have this, I'm really sleepy, but I'm really awake too, right? So if they're not matching up, that's where the problem can lie. So, and we'll talk about more, but this is kind of at least how the sleep-wake cycle comes together. This was like first described like in 1982. So it's actually relatively newly understood. So the natural rhythm, though, can be altered. So there's a lot of different things. So light is the most powerful way to do it, and we'll talk about light a little bit. Other influences can be your genetics, your work schedule, your kids, your habits, caffeine. Caffeine actually blocks adenosine, which is really interesting. So that's actually why when you drink coffee, you don't feel sleepy. It's not that coffee is taking away adenosine, it's just blocking it so your brain can't sense that it's building up in your brain. Mood, general health, your stress, all those things can actually influence your rhythm. Curious if anyone knows that they're a morning person versus a night owl. So morning people, they tend to like to wake up in the morning, they feel more alert, excited, creative in the morning, where night owls tend to have the opposite, where nighttime's usually when they kind of thrive. So I was curious if anyone, morning people? Anyone night owl? Anyone have no idea because it's been so long since you had your own schedule? Yes. That's fair. Yeah. Yeah.
It seems like when I was younger, like in my college years, I was a night owl.
Yep.
But now, I'm more of a morning person.
Yep.
I guess it's something that changes.
Yeah. Yeah, you're not alone. So it's actually, we know that when you're younger, your circadian rhythm tends to be towards night owls. And so actually for a lot of you as teenagers, around the time of puberty, their circadian rhythm's a little longer than 24 hours, so it's actually always shifting towards later. So they naturally become night owls as teenagers. It's not their fault. And then as we get older, it actually shortens, and then you actually have a propensity to want to wake up earlier. Uh-huh.
Is it possible to sort of be both or in the middle?
Yes.
Because sometimes I feel like I'm one, and sometimes I
Yeah.
feel like I'm the other, and it just depends on the circumstance.
It's true. Yes, absolutely. The question is like, can I be both? And people who are like chronobiologists hate this concept because really there's like tons of different chronotypes in between. This is just the extremes of like morning versus night, but you're right. You could be somewhere in the middle. Yeah. No. Great question. But I just show this as kind of just show that there is a tendency towards one or the other, and it's normal for you to have differences. So it's just in defense of night owls, right? So a lot of times people think, oh my gosh, why aren't you getting up early? The early bird gets the worm. You're supposed to get up early. That's what we're supposed to do. And really, we're not. I mean, so the thought is, one of my old mentors, Rafa Pelayo, used to say we're all part of the same tribe, and so everyone has to be awake at all times, right? So some people are awake in the morning, some people are awake at night, so we're actually supposed to all be different. So this is just in defense of you night owls, so it's okay. The worst part is like if you are kind of operating out of your natural propensity, you may always feel tired, right? And then so people think, oh, why do I always feel tired? Why? My friend can get up in the morning and feel great and wants to go jogging in the morning, and and so I'm a morning person myself, but that means by 9 p.m. I'm usually kind of like, leave me alone, I'm done, right? But then if someone wants to wake me up at like 5 in the morning, I'm like, let's go, let's do it. Where I have another friend who thinks I'm insane. So this is just showing that, so if you're fatigued or sleepy, it's always just good to, 1, are you getting enough hours? And then 2, is the quality of your sleep good, right? So There's all these different sleep orders that one can consider. We're not going to go over all of these, obviously, but I would say if you feel like, gosh, I think I'm getting enough hours of sleep, I don't think my sleep quality is good, it's always good to talk to a sleep doctor for that. But we'll talk just about insomnia today. So it's just to clarify that insomnia is not sleep deprivation. So insomnia is that you have the opportunity to sleep, but you're not able to. Where sleep deprivation, you don't have that opportunity. So I just wanted to clarify those two things. So insomnia, just to diagnose it, basically there's a big long list of all these things to diagnose it clinically, but basically if you're not happy with your ability to fall asleep and stay asleep for at least three times a week for about 3 months, you have chronic insomnia. So that's just to simplify it. So if you're like, oh, okay, that resonates with me, it's something that's worth doing something about it. So how it becomes chronic, so it's not just, some people say, oh, you're doing it to yourself, and it's actually, we know that your brain has hyperarousal. Remember that, how I was talking about how it doesn't match up anymore? So it's where your sleepiness is really high, but then your wake is still high. We actually have seen, they've done brain scans where they show that your brain metabolism is actually higher when you have chronic insomnia. And then you often a lot of people will do things that are like, well, okay, since let me try all these different habits to help my insomnia, but unfortunately they actually tend to make it a little bit worse. So that's actually where they tend to be counterproductive. So one thing that is very common for people who have insomnia is like, well, let me get to bed as early as possible, so that way I know I can maximize my time in bed so I can get as much sleep as possible. Unfortunately, what this does, it increases your efforts to sleep, increases your stress about sleep. You're more frustrated, right? Because then you're in bed and you're not sleepy and you're just like staring at the ceiling. And then you just kind of go to bed like almost like the battlefield, like, oh, well, let me see what happens. Probably not going to sleep, but let me go to bed anyway, right? And so it kind of starts to make it worse. I see a lot of like, yeah. So very common, right? It's no one's fault. It's very logical to try these techniques, but unfortunately they just are counterproductive. And then this is just showing like if you have how trauma or like a traumatic event can actually also affect it too. So this is a little bit of a complicated slide, but basically to highlight here, this is just showing that you can have predisposing factors, as we talked about, that determine what your sleep cycle usually is. You have some kind of traumatic stress that happens, a pandemic, something like that. And then you have this acute disruption of your sleep schedule. And then now you're kind of in this, depending on if I have different factors such as coping strategies, stress busters, a soul food salon, you learn about things, you kind of do things better, then maybe you're like, okay, I'm actually able to restore back to health and it's transient. But then for a lot of people, for whatever reason, it actually stays and they then have this kind of sustained effect in their, or chronodisruption or effect in their sleep-wake cycle. So you're like, okay, so what do we do about it? So I always think of like the stepwise approach to kind of preventing or treating insomnia. So really level one, I always think of it like just like sleep education, just thinking of basic sleep habits and just kind of help buttress your sleep. Level two is kind of getting a sleep specialist to help you with the behavioral techniques, interventions, et cetera. And level three is usually like kind of you're adding medications to support these behavioral strategies. So I like to say it's all connected, right? So I think an integrative approach to sleep health is required. I really do. I think a lot of people say, oh, just fix my sleep and then my anxiety will go away. Fix my sleep and then all this will, and I'm like, oh, let's do them together. So I think it's really important to think about are you stretching enough? Are you moving? Are you getting enough fresh air? Are you eating well? All of these things affect your sleep. So a lot of times I just had a teenager who I saw the other day who I know I completely frustrated because she's like, no, I'm not worried about my sleep schedule, but just make my fatigue better. And I was like, okay. So we're working on it. We're in ground zero for her. She'll get there. But I think it's just important to realize that all aspects of your life can really affect your sleep and your health. So first, I think a lot of people have already heard this, establish a good routine. A lot of you who've raised kids, when you were putting your kids to bed, you knew, okay, I have a crazy toddler who's running around all day and I want my toddler to now sleep. I know I can't just pick up my toddler, throw him in bed and say, go to bed, right? It doesn't work. You have to have this whole transition, right? You read them a story, you give them PJs, right? All the things you do, right? Because they need a transition. We're the same way. For some reason, I don't know why we think we don't need that, but we still do. So I think just having a wind down, especially our lives are more stressful than a 3-year-old's, right? So thinking of just doing something to help you wind down. Read a book, listen to music, try not to eat 2 to 3 hours before bedtime or have a big meal just because your body is like, are we resting or are we metabolizing? What are we doing? avoiding screens, which I know we've heard over and over again. And I always say avoiding stressful activities. So maybe this isn't the time to bring up that thing that your husband did the other day, right? Remember that thing that really ticked me off? Like maybe don't bring it up then. Bring it up, but maybe not right before bed. And I always say reserve your bed for two things. One is which is sleep. And then leverage your light exposure. So really kind of using well-timed light exposure can help. So I know we know about the parts about light that aren't great, but there's all this really great evidence that proper light exposure can really help your mood, your sleep schedule, et cetera. So your light is actually, I already mentioned how it's the most powerful influencer of your circadian rhythm. So your clock is more susceptible to change in the first hour after waking and within 2 hours of your typical bedtime. So it's almost like I tried to get this analogy. It's like you have like the unlock codes to adjust it, like right when you wake up and right before you go to bed. So those are the times you really want to be very deliberate about light exposure. And there's all this really great evidence about morning light specifically that can actually help treat even depression by, they think, increasing your serotonin levels naturally, reduce chronic pain and symptoms of that, and actually improve your sleep patterns. And I'm just including this, and I can, maybe we can send this out, but there's this actually whole lecture by the NIH. There's this National Center for Complementary and Integrative Health, where they actually go like a really deep dive. It's like a nice hour-long webinar where they just talk about morning light and exposure. It's really, really fascinating.
So does that then reinforce the idea that, what did you say, in the morning, the early birds have a better sort of, I don't know,
Oh, well,
relative to night owls?
great point. No, so that's a really good point. So it's not so much, right, when I say morning light, it's more of like that light upon first waking up. So even if you're someone who maybe wakes up like closer to like 10 a.m., maybe that's your schedule, it's still like getting that light first when you first wake up. So touche. Like, so she's asking like, oh, is that why, being an early bird is better or not? Necessarily. I think it's just really our society is built around early birds. But even if you're someone who wakes up later, just getting like bright light on your eyeballs specifically without sunglasses, without hats, like actually getting light is really healthy. And the thought is actually not even through a window, actually going outside, fresh air. I tell my teenagers, go outside, and they're like, what?
First hour of waking is the most important. First hour is
Within that first hour of waking up.
first hour when you.
Okay. Yep.
Do that too often, but
Yeah.
probably stay inside for the first hour and then maybe go out. But yeah.
I know a lot of times we wake up, maybe we because we're still not ready, we keep like the lights down, we maybe like chug down that cup of coffee, the first one, and then maybe we go outside in our cars, we're in our sunglasses, and we don't, so we're kind of like missing out. But it's like even in the first hour, even just get 5-10 minutes and like take a quick walk, actually can be really helpful. And that's one thing that I've been trying to do more for my schedule. And it's hard because I will admit, there's all these things I got to do, and so it takes a deliberate action.
Oh, that's interesting. Yeah, okay, thank you.
Yeah, and I don't know if Andrew Huberman, I don't know if you've ever heard about
gonna
that.
mention him.
Okay, great. Yeah, so he does a whole lot of talk about this. So again, if you want to dive into the science of it, it's fascinating. So he talks a lot about morning light. So is that what you guys are? Yeah, it's really great.
Andrew Huberman has a podcast. You can really, he's a Stanford neuroscientist.
Yes.
Talks a lot about your first hour waking up, getting outside, and this exact point.
Yeah.
But his podcast is really great.
How do you spell that last name?
H-U-
Yeah, Huberman.
Andrew.
Yeah.
Yeah.
Yeah, he's this great podcast. I mean, they're and he goes like some of them are like 2 hours long.
Yeah,
they're
they're
very
long.
Detailed. I'm so glad. Oh.
Okay.
Yeah. Oh, this is great. I love a lot of morning light enthusiasts in the room. This is good. I think it's really fascinating. And the other thing, like kind of on the flip side of it, people always ask like, okay, well, what if you're going to make me wake up in the morning and I don't like waking up in the morning, getting this morning light. What if I get tired in the afternoon? Can I take a nap? Right? That's usually what people ask. Sure, naps are fine, but keep them short. So the reason why is you take a longer nap. Anyone woken up from a nap and they feel like they need to take a nap from their nap, right? You feel more sleepy. So it's really because then you have more sleep inertia. So if you keep the nap less than 30 minutes, that actually helps it. I just love this slide. This cracks me up. I know. I don't even know where I found it, but I only had to change it because they said sleep for an hour, and I'm like, no, 30 minutes. Take a nap. It fixes everything. And then people go like, what about coffee? I love coffee. So I love my coffee, and I will never give it up. I love the routine of it. I love the smell. So people go like, are you anti-coffee? No, I'm not. I'm not anti-coffee. But it's important to remember caffeine is not a replacement for sleep. Remember I said like your adenosine's building up in your brain and caffeine just blocks the receptors, but that adenosine's still there. So you ever had that crash after, right, when your coffee wears out? It's because all that adenosine is built up in your brain and finally it's rushing to all your receptors. So just important to remember that. And then if you are gonna drink caffeine, coffee, tea is better than soda or energy drinks, which I think this is a group that knows it. And then green tea specifically has L-theanine and EGCG, which has sustained effects. You don't get that jitteriness. It actually is found even, green tea is a natural detox for the body. L-theanine has actually been shown to help with cognition, so it has all these great benefits too. So if you really need like a sustain, you have to be up all day and really focus for a long period of time, green tea is actually a really great alternative. And then avoiding caffeine within 7 hours of bedtime. And I know you're gonna tell me, oh no, I can drink coffee right before and fall asleep, it's fine. So yeah, that may be so, but we know that actually coffee also decreases your slow wave sleep. So even though you might be falling asleep, you actually are affecting your quality of sleep. So I will say, like, again, I'm a coffee addict right here, but like at the same time, just really trying to reduce how much caffeine you get right before bed. Yes.
So this is an overly technical question, but when you say the adenosine is blocked, and then when the caffeine wears off, then it rushes to your receptors. So when it's blocked, where's it hanging out?
In your brain. Oh, like exactly. Oh, no. Within like, I'm like, just ran. Oh goodness.
Maybe in the
Probably
blood.
within the synapse. I don't know. It's like, yeah. I'm looking at Dr. Rossner for help here. It doesn't get.
Up somewhere,
It doesn't get downgraded, so or degraded. So I think the thought is like once it kind of hits its receptor, you think it doesn't go away. So it's still there, and the only thing that actually makes your body kind of get rid of it is sleep. But you're asking a very good technical question, but I got to be honest.
Immediately when I was
Where does it go?
Anyway, thank you all.
Yeah.
What about decaf coffee?
Oh, so decaffeinated coffee still has some caffeine in it, but it's less. So yeah, so that's generally better. Yeah, that way you kind of get the experience without getting all the caffeine. Yeah, great question.
And that would include chocolate, because I find I don't sleep as well if I have a real chocolatey dessert.
Yeah, some chocolate does have caffeine as well. I know, yeah, sorry.
Chocolate is like, especially dark chocolate, right?
Exactly, dark chocolate. And there's also the sugar in there too and all those things. But I think you're right, a little bit of the caffeine. Some people are more sensitive to it than others.
Oh, so people have different sensitivities, yeah.
I think, yeah, for sure. Like my mother, for instance, is very sensitive to caffeine. I mean, she'll even have a decaf coffee in the first part of the morning and still be like up. She's just like, where for me, I'm the same way. I used to say like, I can sleep with it. I don't need, it's fine. But I think everyone has different sensitivities. And then this is from one of my colleagues. She's actually a PhD in nutrition scientist, and she recommends actually warm drinks. So if you're trying to stay awake, warm drinks actually tend to help reduce sleepiness. This is not saying you can't have a cold brew, but if you're really kind of wanting to maximize kind of warming up your body temperature is thought to actually help. The reason why is because actually your core body temperature when you're part of when you're feeling sleepy is actually your core body temperature starts to decrease as you're feeling sleepy. So it's kind of a sign that you're getting ready for bed when your core body temperature drops.
And in that vein, you should kind of have your room cold at night, correct?
Exactly, which is why a cool dark room is thought to be optimal. Yeah, great question. And then a lot of people ask about what about exercise? Maybe, right? So it can boost your mood, it can relieve stress. You know, some people need it. It's to kind of help them relax. But really intense exercise before bed is not usually recommended because it hypes you up. So really, I think a little bit of troubleshoot, see what works best for you. But usually, general intense exercise before bed isn't really recommended. And then what about a nightcap? Like people go like, oh, but if I have my glass of wine, it makes me feel sleepy. It's great. So here, it may help you fall asleep, but it's really, one of my colleagues always say it's a short-acting drug, right? So after 3 to 4 hours, it metabolizes and you are awake. So alcohol is really associated with less restful sleep, more restless sleep, increased heart rate, resting heart rate, increased sleep fragmentation. So even though maybe it helped you fall asleep, it actually doesn't help the quality of your sleep. So ideally trying to limit alcohol before bed too. And then just mentioning a lot of non-pharmacological options that can help you prepare for sleep: weighted blankets, white noise machine, massage, lavender chamomile, all these things, stretching, meditation, breath work. All of these things have been studied. And I think there's varying degrees of how effective are they? And a lot of people ask, well, do we have like this and that? I'm like, well, okay, we have some studies, but honestly, the great thing about all of these is the side effects are low, right? Massage, who got hurt by a massage, right? So I think just the way I look at it is like, yes, maybe, for some people they help more than others, but I think it's, again, the thought is to kind of relax your nervous system and kind of help you get into a more of a relaxed, safe state. Okay, so I know I said stepwise. I'm going to go to level 3, step 3, because I feel like that's usually what people are really wondering about. So I'm going to go there before we go back to the behavioral strategies. So let's start with supplements. And so I say melatonin is a supplement because in the US, it's actually not regulated by the FDA. In Europe, it is. Actually, it's a medicine in Europe. But in the US, it's considered a supplement. Over the counter, and it can be in liquid, chewable, sublinguals, gummies, tablets. It can be short acting. It can be extended release. The doses available are 0.25 all the way up to 20 milligrams. So you can find all of it. There's a few that are USP certified. This is a third party that they actually kind of look at some pharmaceutical or supplements to kind of see, to kind of verify that what they say is in them. So it's kind of even though it's not regulated by the FDA, it's a little bit of a reassurance that what you're taking is what you're getting. So when we look at a meta-analysis of melatonin, when timed specifically, and I'll explain what the dim light melatonin onset is, but when timed right, it actually can reduce your sleep latency. It can increase your total sleep. It can effectively shift your sleep-wake cycles. So it can work and can really help with all these things. There's possible side effects of daytime sleepiness. Some people have dizziness. Some people have vivid dreams or nightmares with it. Less common, some people get some irritability, some headaches, some nausea. There's a question of effects on immunosuppressive therapies. So like if you have a transplant, it's interesting. Some studies show that it increases the immunosuppressant drugs and some studies show that it decreases. So it's kind of mixed. And then there's possible hormonal effects. It's really kind of unclear. So to be honest, it's not that well studied for long-term side effects. Most of the studies for melatonin are actually in children with autism, believe it or not, or ADHD. And usually those are short-term studies. So a lot of people go like, okay, well then that's all complicated. Well, how do you use it? Okay, so I, as a sleep doctor, I like to use it to support things. So what melatonin does, it actually kind of makes sleep more inviting. So it doesn't knock you out. It's not, people think, oh, I'm gonna take it and then knock out. No, that's not how it works. It's supposed to kind of help signal your brain, hey brain, I'm kind of ready to fall asleep. I'm ready to kind of relax. And so I recommend it when it's used in addition to these behavioral strategies I'll talk about later, as you help establish your routine. And then if you actually, so does anyone like tend to travel like internationally or like to Europe or Asia? Anyone? Yeah. So it's actually really good for jet lag. So, and I realized, it's funny because I always have the slide where I talk about it, and I can maybe send something later. But basically, it's a little complicated of a science. But if you actually time your melatonin and your light exposure in a specific way, you can actually help shift your jet lag a little bit easier. So there's an app actually called Time Shifter. That you can actually, I think it's free, I don't remember exactly. But you can actually enter where you're going, the time of your flight, and it can tell you actually what to do to reduce your jet lag. Yeah, it's kind of amazing. So, and I think it's based on, a friend of mine asked me about it and I checked it out and I'm like, yeah, that's legit. It actually is based on science. So Time Shifter is what it's called. So it shows. So melatonin can work in those specific ways. So let's say you're using it just to help you fall asleep. Usually take 1 to 3 milligrams about 30 to 60 minutes before bedtime. And then I know a lot of people go, well, oh, but I thought more is more. Honestly, your brain doesn't really need like 10 milligrams. The side effects of having higher doses of melatonin is that you just feel groggy during the day. So usually 1 to 3 milligrams is usually enough. Like sometimes if I feel like I need it, like I haven't been great with my day, I'm on the computer too long, and I'm like, oh man, it's midnight, I need to go to bed. I'll usually just do like a little bit of melatonin and be okay. And for shifting circadian rhythms, it's like even smaller, 0.3 to 0.5, like 5 to 6 hours before.
And what about if you use time-released melatonin?
Oh, great. Yeah, great question. So that's about time-released melatonin. And so the thought of time-released melatonin is that you have actually a short-acting that happens quickly when you take it. And then the time-release, it's a pill that's like slowly kind of dissolves over time. And so the thought is that it's kind of still giving you short-acting melatonin, but over time. So the thought is that it's supposed to help you stay asleep longer. The data are mixed as if it really works, but I think anecdotally people really like it. So the trick is that it's only a pill form. The nice thing is, though, there's a couple that are actually USP certified. So there's a few time release options. Like I think Natrol is the one that's listed. Again, no, not that I'm like endorsing brands, but they just happen to be one that's listed as USP certified for time release melatonin. Yeah.
How does the melatonin interact with adenosine and caffeine, or is it a completely different system?
Completely different system. Well, I mean, yes, different system. I'm trying to think if yeah, they don't chemically interact, but they're kind of related. Right, good question, very good question. I put this is, you know, again, a really busy slide, but there's so many supplements out there, like for people who ask about sleep too. So I wanted to note, so iron can sometimes actually help with restlessness. So if you tend to especially be iron deficient, sometimes actually treating with iron can actually help you feel more settled and actually help you fall asleep.
So should you take that at night versus?
Maybe. So, not necessarily. So it doesn't matter the time of day you take it. It's just more if you can get your iron levels back up, that's supposed to help with restlessness. So the time, it's not that it's like a short acting. It's more of like if your iron levels are low, you're more restless. If you bring it back up, you'll feel better. Okay. I do recommend, though, if people want to take like, you know, high doses of iron, you really check your iron levels first. But that's something to think about. Magnesium is something that's really popular. So there's different, it helps with muscle relaxation, helps induce sleep onset. The dose is generally up to around 360 milligrams is what's kind of recommended. So there's different types of magnesiums. There's magnesium glycinate, there's magnesium citrate, and magnesium oxide. These all have different levels of like being more calming versus more laxative effect. So just to be aware of which one you take. They all can help you relax, but maybe not in the way you want. The great thing about it is, like, you know, if you take a little bit too much, then you'll know, and then you can just back off a little bit. But these are, and to clarify, all of these like supplements I'm talking about, again, have varying degrees of evidence around them. So I'm really talking about ones that are safe, you know, have very low side effects. But magnesium is one that's very popular that people can consider taking. Valerian root is something that's thought to help reduce anxiety, help with relaxation, may reduce your stress response. And the thought the dose 300 to 600 milligrams daily may have modest improvements in sleep quality, but it's thought to take up to 4 weeks before it takes effect. Lemon balm is another one that helps reduce relaxation, but it's only studied in combination with the valerian root. And then hops, so doing like non-alcoholic beer, that's another way to get it. It's supposed to help with sleep disruption, reduces sleep latency, and again, it's only been studied in combination with valerian root. So it's very mixed data. People go like, well, is it just the valerian root that's helping? Maybe. Passion flower is also something that's been studied. Chamomile, very common. I think a lot of our grandmothers gave us chamomile tea. It works, right? So it promotes relaxation. L-theanine, I already kind of mentioned that's the same thing we see in green tea naturally. This is thought to help with cognitive attention, improves attention. And the thought is actually when you have just more, again, it makes you feel more settled and helps you feel more relaxed. Lavender, I think a lot of us are very familiar with that. Aromatherapy, oil, it's in teas. The dose varies when you look at like what's the right one, from 80 to 160 up to 500 twice daily. So again, it's mixed data, but something that people can try. And then even tryptophan, something you can also get to. I don't know if people have seen this in stores, but this can also reduce your nighttime awakenings and parasomnias, may reduce the time it takes you to fall asleep. But the studies were about 1 gram in healthy adults 20 minutes before bed. So I know this is a lot, and luckily we'll just have it posted. You can look at it later. But just to show that there's a lot of different things out there with varying degrees that might be helpful. Yes?
How about ashwagandha?
Oh, great. Oh, yeah, ashwagandha is thought to also help with relaxation and be a good one to help. Again, the same thing where the data is pretty mixed, but it's thought to be pretty safe. Some people do have side effects of having more dizziness or stomach upset with it. But I think ashwagandha is one that people use for sleep too.
For the melatonin, if you get those nightmares, is there a way to not?
Yeah, I don't know that there is. So you generally, like when my patients say that, oh, I get nightmares or vivid dreams with melatonin, that's upsetting, I just say stop it. Yeah.
Isn't tryptophan in turkey?
It is.
They're all going into turkey.
It's true. Yeah, a lot of people say like there's other foods, and I should have looked at that actually have even more tryptophan than turkey. A lot of people think, is it the turkey that causes you to be sleepy, or is it the fact that you just kind of ate a whole bunch? It's probably the latter, but it can't hurt. And then this is Jeannie had a great question. I hadn't put, so I just added this slide right before about hormones. So a lot of people will ask about that. So it's interesting. So perimenopausal women have a higher risk of sleep disturbance, and it's thought to be related to fluctuating hormone levels. Some people think is it just because the hormone levels are low? Not necessarily, because actually they say postmenopausally you actually can have an improvement in your sleep, which is really interesting. So it's like while you're going through the adjustment, it's thought to be worse. But if after you're in the postmenopausal period and your sleep is still disturbed, the thought is you can consider hormone replacement therapy, which is progesterone and estrogen. Progesterone specifically is supposed to have like a hypnotic or a sleep-inducing or a calming effect. And that may help mitigate even effects on sleep disorder breathing. So even like you may have some sleep apnea, so that to even help with that. The mechanism of that is not fully understood, but at least we know that it can help your sleep. So something to think about and talk to your doctor about if it makes sense. So real quick about medications. So I'm just going to give one big slide about all of them because so the American Academy of Sleep Medicine has like some clinical guidelines saying, okay, well, if you need to use medications, which ones do they recommend they do? So they're kind of trying to put all the evidence that's available, put everything together and go like, okay, based on what we know, which ones would be reasonable. So the thought is for these ones are for sleep onset insomnia. That means you have a hard time falling asleep. These are all thought to be short acting, relatively quick things that can help you fall asleep. And then for things to help you stay asleep, these are ones that are actually stay longer in your system. So if people feel like they have a hard time staying asleep, the thought is you need to give yourself at least 8 hours to actually sleep, because a lot of people will take these and then they have to get up early, then you're still drowsy, and you're waking up still drowsy because they're still on board in your system. And then this, they say that's not recommended for insomnia, but really the reasons why, for the melatonin, tryptophan, and valerian, it's just because of lack, like I said, not great evidence. It's not that it's necessarily dangerous, they just thought there wasn't great evidence. Diphenhydramine, this is like your Benadryl. The thought is taking this long term can actually cause potentially urinary retention and maybe some cognitive issues. And then trazodone, especially for people who are older, it can make you more unsteady and groggy in the morning, and there's more risk of falls. So I just put this on here as like, so if you need medications, these are something to think about, but it's really important to note that none of these are considered long-term medications. So a lot of times people will say, like, oh, I've been on Zolpidem or Ambien for years and years and years. I'm like, oh, it's not designed to do that. It's really designed to like maybe help you in the short term. And so even note, in 2019, they actually did a boxed warning for these medications because of these things called complex sleep behaviors. So the kind of really popular medication where they had people were doing accidentally overdoses, they were falling, people were driving while not remembering, doing all sorts of different things. So the thought is, that the risk was too much, though I will note 66 cases out of 26 million prescriptions, right? One could say, the odds are there, but I think it's important to note that, even the FDA has been like, oh, they're, really kind of think before you do them. And then when you look at the effectiveness, a lot of people go, okay, cool. I get it. There's risk of side effects. How effective are they compared to all these other things? Short term, they can work, but with potential side effects. But long term, they're actually less effective than behavioral strategies. So over time, your brain actually just doesn't respond in the same way. So, which is why going to level 2. Oh, yes, please.
So occasionally I'll use a Tylenol PM
Mm-hmm.
To help me fall asleep, and it does work.
Mm-hmm.
But I also found out that after if I use it for a couple of nights, then once I stop it, then I actually have a harder time falling asleep.
You get-
So, is it like some kind of withdrawal situation, or sort of what's?
Some of these medications can cause like rebound insomnia, right? So what you're feeling is like our brain is fascinating where it just kind of gets used to things, and when you take it away, it's like, well now where's my Tylenol PM? I'm used to it. So yeah, you can get rebound insomnia with a lot of these medications. Yeah.
So maybe better just to not deal with the ups and downs.
That is my opinion. Yeah.
And the Tylenol PM has Benadryl in it.
Yes. Yeah. Thank you. Anytime it's PM, usually it's diphenhydramine or Benadryl that they're adding. Thank you for that. Yeah, thank you for noting that. So you're like, okay, great. You talked about meds. You weren't that positive about it, Caroline. What should we do? So there's really it's behavioral different things, and I say behavior not. And I think sometimes when people hear that, like, oh, so I'm causing my insomnia? No. It's just different things that you can do to actually help your insomnia better that are non-pharmacologic. So something called cognitive behavioral therapy for insomnia. Has anyone heard about this? Okay, a few. Okay, so a few people and some it's new to some. So this is actually considered the gold standard for treatment of insomnia, no matter what's causing your insomnia, whether it's pain, anxiety, sleep habits. This is actually what the American Academy of Sleep Medicine says is the gold standard. So it's actually a series of things. So first, you identify these behaviors and cognitions you have around your insomnia. So remember I said you're like going to bed like, oh, this is the battlefield, let me get to bed, it's probably not gonna work. So it's just kind of like calling that out and being like, hey, do you realize that you do that? And you're like, yes, right? So that's one. And then, oh, you realize how you go to bed like at 6:30 to try to make sure you get enough sleep? That may not be working. So really one of the first things is just noting that. And then next is kind of like, okay, restructuring. So letting you know that your brain can fall asleep. It can work. A lot of people think, oh, my brain's broken, it doesn't work. No, it can work. So that's one of the other things too. So it's kind of helping with that. And then utilizing then behavioral strategies to reestablish your association with your bed with sleep. Because right now, if you have insomnia, your bed is like, is it where I worry? Is it where I stress? Is it where I do my emails? Like, what do I do in my bed? Your brain's trying to figure out the association. So you're trying to restructure your association between your bed and your sleep. And then you start establishing the regular sleep-wake cycles, those healthy habits we talked about earlier, that you're kind of incorporating all of that. So a lot of times people hear this, they think, oh, this is just sleep hygiene. I'm like, no, it's actually, sleep hygiene is part of it, but it's more complex than that. And then it's also employing psychological and behavioral techniques to really diminish this hyper-arousal and anxiety around sleep. So this is great. It works well. Everyone loves it. It's like the gold standard. It's awesome. The hard thing is it's not always that easy to find people who do this, right? Because, if you think about it, having someone really help you with the anxiety about sleep and the cognitions around sleep, you usually need someone who's like trained in this. So a lot of times people just need it's usually through psychologists who do this. So it's not that they're getting psychology therapy or CBT traditionally, but it's really around specifically for insomnia. So you could do in-person therapy is the best. That's by far. There's some self-directed therapies online, and I'm just showing a couple. I mean, there's tons, but I'm just showing a few that actually are by sleep-trained physicians. So first is Brandon Peters. He's a doctor out in Seattle. Actually was trained at Stanford. This is by Rachel Manber, who's actually an international insomnia specialist here at Stanford. Is really great. And then here's like another workbook here. So these are just examples of you can actually even do this self-guided form of CBTI. So when I think of but you're like, okay, that's great, but what can I do now? How can I help myself now? So if, and this is, using the principles of CBTI to actually, that you can do more practically. So first is you pick your ideal wake-up time. And I say this, your truly ideal wake-up time. If the time is realistic, right? If you're like, well, ideally you want to wake up at 7 a.m., and I could do it. I could wake up at 7 a.m. Cool, anchor that wake time and then just know, okay, I will wake up every morning at 7 a.m. If you're like, my ideal time is 7, but I'm waking up at 11, maybe then I say gradually move towards it, right? So I always tell people okay, well, I want to wake up at 7, but right now I'm waking up happily at 10. So maybe let me start at 9:45 and then maybe 9:30 and then, and kind of move towards it slowly. Avoid the snooze button. I know we all do it. It's tempting. We think those 7.5 minutes will be glorious, but they actually make you feel more tired. So avoid the snooze button. And then we were talking about morning light. I won't go over too much, but especially if you happen to have to wake up earlier before the sun is out. There's actually a lot of research with light boxes. I was in Portland, Oregon for my residency, and so you don't see the sun for a long time, and I'm from Arizona, so you can imagine how that felt. And so it's actually a light box or a SAD light, and you guys probably have heard these terms, but if it's at least 10,000 lux, that's thought to be actually sufficient. And then do something enjoyable in the morning, right? So don't just make it just, actually do something you enjoy. So maybe it's journal, walk the dog, play a song you like. I don't know, do something that actually makes it more exciting to wake up. And then determine, so that's what you're doing with the morning. And then let's say for bedtime, so determine your bedtime. A lot of people go, how do I know what my bedtime is? Well, count backwards, right? So, okay, your ideal wake time is whatever it is. And then a lot of you, everyone kind of knew, I need at least 7 hours, I need at least 8 hours. So then just count backwards and establish that wind down routine like we talked about. Go to bed when you're sleepy, right? You're like, well, duh. No, but really when you're truly sleepy, when you think you're gonna fall asleep. Let's say you get into bed and you're not sleepy. I actually want you to get out of your bed, do something boring or relaxing until you get sleepy again, and then go back into your bed. And you might say, well, what if I go back to bed and I'm not sleepy again? Well, then get back out of bed, do something relaxing, and then go back in. For the first couple of days, you're going to be cursing my name. But eventually, the thought is your brain's like, oh, I see what you're trying to do. You want to reassociate your bed with sleep. Got it. And eventually, it'll get easier.
Does that apply,
No, please.
does that apply to waking up at like 3 in the morning?
Yeah.
Like I'm wide awake and
Ooh.
I'm doing this, and then I go in the other room and I read for a while, and I get sleepy, and then I go back to bed, and I do go back to sleep. But I'm wondering if I'm setting myself up for a pattern of,
No, it does apply. You need to get up at 3 in the morning. Yeah.
oh, it does.
It does, yeah. So you want to definitely, so you want to keep all the lights dim, so reduce light exposure and do something boring. So if you're going to read something you've read before. So maybe not the book like, oh, I've been waiting to read that book all day. Like, don't do that. And so, because then you're going to be like, right? The same principle applies. And I think we had another question.
So that was the same question.
Oh, okay.
Even if you lose, let's say, an hour or 2 of sleep, you still should get up at 7?
Yes. Okay. So so a lot of people will say, well, okay, you're restricting my sleep. So sleep restriction is one of the key treatments of CBTI. And a lot of people will say, well, wait a minute, but if I'm sleepy, why would you like decrease it? I'm like, yes, because I'm trying to maximize your sleep drive. So that first day, you're, again, cursing my name. And then after a couple days, you're more sleepy. And so the hope is that it's actually easier for you to fall back asleep the next night. Yeah, so that's why for the first, so don't start this like right before like a big job presentation or, like an interview or something. Like do this like when you have a little bit of wiggle room to be a little bit more tired for a couple days. Yes?
But, you say the room should be cool, but I like to be nice and cozy and warm. So, and then if you try and get up in the middle of the night, you're like freezing. So, I don't know. Being nice and cozy and warm is not good.
Everyone has like slightly different preferences. You just don't want the room to be warm. Like, so I'm someone who also likes to be totally tucked in, to be honest. I've already busted out my electric blanket, to be honest. Like I like it warm, but then it shuts off after like an hour, So being cozy and tucked in is fine, but you don't want the room to be warm. Because we just know that when the room is warmer, you tend to have more sleep disruption. But within reason. Like there's some people who think a cool room is 62 degrees, right? Which to me, I'm like, that's freezing, right? Where some people, a cool room is like 68. So I think adjust a little bit.
Do you wear an eye pillow at night? Like if you want it dark, but you don't have shades on?
Oh, I love that. Yeah, you could. Yeah, if it's not too disturbing, you can definitely do like a light eye pillow. I think something like satin is usually just a little gentler on your skin, or blackout curtains.
And for the blackout curtains, you want full-on blackout? Because there's all these even variations.
I know. Well, I think, again, if someone's like, oh, my sleep is fine, then you don't have to worry about it. But if you're like, I'm really struggling with my sleep, I'm waking up, the light's really affecting me, I say full blackout.
Full blackout. And then at 7 a.m. when you wake up, it's like, boom.
Yeah, open it up. Exactly. Yeah, open it up, go outside, sip your coffee out on the patio. Exactly. Mm-hmm.
If you could wake up at 3 a.m. and you're recommending that we get out of bed and go do something boring. If we wanted to read on our iPad, is that not recommended? On the lack of the blue light, if you have it the setting.
It's still, the thought is that you're still having the light. So granted, is low light, the blue light, and the night setting where you have like less blue light better than having the full on? That's thought to be better. Ideally, if you can avoid using a screen of some sort, that would be best. But again, nothing, I'm doing everything perfectly. So I always say, try a little bit. If you can do really dim light, have that night filter on, that may be okay. But if you're really still like having trouble falling back asleep, then maybe switch over to just a regular book. So it's a little bit trial and error. Sorry, I saw other hands, but they came up and then went down.
And read in a chair, not sitting up in your bed.
Exactly. Yeah, ideally in a
Your bedroom in a chair is okay?
Ideally leaving your bedroom, right, in a perfect world, but I know not everyone, has like another space. So, if you can't, but at least like trying to change the environment.
Yeah.
So even I have some patients who are even wheelchair bound, right? And so for them, it's like, I can't just like get up and move. So I actually say, well, just change the environment. So either prop yourself up or just make your bed different, change your blanket, take your blanket off, like do something where it's like, okay, this is my wake up time. So if you can't leave your room, sitting in a chair at a desk, on your floor, leaning against your bed, just something to make it a little different. Yeah.
I wake up in the middle of the night, and sometimes it's just like 10 minutes, and I'm just thinking, and all of a sudden I fall asleep, and sometimes it's a half an hour, and I'm trying to figure out what time I should get out of bed now.
Oh, yeah. You know, and Granny, I don't want you to watch the clock because, yeah, exactly. Because, you know, yeah, so avoiding watch the clock, but I think it's like, you know, 10 minutes is actually generally, and I'm sure if you're up for 10 minutes, you're like, okay, I was up for 10 minutes, not a big deal. But it's like when you feel like, I am not going to fall back asleep. So I think that's the feeling that I think it will prompt you to get back up. So I don't want you to like time it or like go, but just know when you're like, I know I'm not going to fall back asleep.
Okay.
Yeah. So estimation is fine. Yeah.
In the same vein, like, I'm not getting up at 3, but I'm noticing that my body wants to wake up for like 5 now. And so maybe that's just, do our rhythms change, as has been noted earlier, maybe just with age or hormones or whatever. Should we just stay up then? You know, if the whole house is quiet,
I was,
nobody else is up.
Take advantage
well,
of
I'm like, so I think it's, the question is it okay for you? Like if you're like, I'm waking up at 5 now, oh, that's weird, but I actually kind of like it because it's quiet, then fine. But if you're like, I'm waking up at 5 now, oh, but it's making me fall asleep too early, I can't hang out with my partner or my friends, then it's a problem, right? So
Just determine what works.
exactly. So I think if waking up at 5 a.m. is working for you, I say, you know, go for it. But if it's then translating in that, you know, I don't like waking up early because then I'm by myself and it's boring, then I think there's one of the specific things you do is, again, avoid light exposure as much as you can and try to do things kind of really boring and relaxing. And thinking about how you spend your day, you know, are you going to bed too early? Like what's, you know, try to think of things to kind of adjust. Because are you waking up at 5 a.m. because you're done sleeping and you feel like you're awake, or are you going wake up at 5 a.m. because you're also falling asleep much earlier?
Yeah, sometimes it's probably because I'm going to bed earlier.
Yeah.
So I'm trying to get more rest.
Right. Yeah.
So I'm trying to change it, but my body hasn't changed.
Exactly. So it could be that one thing you could do is just try to go to bed a little bit later, if you can. Now, you know, don't push yourself too much. I don't want you to be miserable, but maybe if you're like, oh, can I push it an hour and see if I can then wake up a little bit later.
Bodies aren't really, you know, watching the clock.
Exactly.
It's just we are trying to,
Yeah.
Just a question backtracking a little bit about the cognitive behavioral therapy.
Yeah.
Does that address anxiety? Because I find that's the thing, I'll wake up and I'll even think about banana pancakes and I can get stressed.
Yeah. Yeah.
And so
Yeah.
does that address that? Does it give you good techniques?
Yes, and that's why, so like true CBTI is usually done with someone who's trained. That's why I said it's often with the psychologist because they also can deal with that anxiety piece of it too. Yeah, so that the true CBTI is specifically designed to treat that. But I know, like I said, I only mentioned this as like, you're like, okay, well, if I can't get to see someone? But if you're like, it's that anxiety, man, I gotta really, then that's where I think going to a sleep specialist is helpful. Yeah.
Has there been a lot of research on the hormone, the fluctuation in hormones and sleep cycles? I know you had one slide on it. I think that's an issue I struggle with.
Yeah.
And can you just buy progesterone like over the counter? Can you get it? Or how do you?
I don't think so. I'm sure you can progesterone, like, but I would be cautious of taking any like over the counter one. I would. So yeah, and like I said, Jeannie asked this great question. I wish I thought to put more in there, but I think what we know is if your levels are low, it can definitely affect your sleep for sure, and then progesterone can improve your sleep. You know, but then again, HRT, you know, I was saying it's controversial for many different reasons. Exactly. So I always tell people like this, I think we're talking to your doctor and making sure you're getting like a good source of it, makes sense, the dosing is right. I do think talking to your doctor is good. And if you have a doctor who's unsure, I think find a sleep specialist, find an endocrinologist, find somebody who knows, because there are people who really can help you navigate this for sure. Yeah, it's very important. Please.
I'm sorry. So if, 7 to 9 is kind of ideal, maybe 7 to 8. And if you kind of routinely just get 6 and feel like, well, 7 really feels better, but you keep waking up just on your own, it's after 6 hours. It's like you're not tired enough to be able to sleep another hour, right? So I guess just get up.
Yeah, so you're saying that you feel like you need 7 hours of sleep, but you just kind of keep waking up early and give yourself 6 hours of sleep reliably. Well, I think what we do know, so so as people get older, that is more like early morning awakenings does happen more. And so that's a case where actually a lot of times people say trying naps is not a bad idea. So if you feel like in the afternoon, if you're like, I'm dragging and I still have all these other things I want to do, I'd say try a nap. So maybe, generally we like to have sleep be consolidated at night because it's just for many reasons. It's just more convenient. It works better with most people's lives. But I think especially as we get older, I think sometimes taking that nap in the afternoon can work too. So that's the
actually really truly falling asleep or just lying down and resting and
Oh, truly like falling asleep, like taking a true nap. Still keeping it short. I would, I'd play around with it and maybe not plan for an hour nap, like I said, for that sleep inertia, but maybe half an hour is enough to kind of get you that jump, if possible. I know not everyone can take a nap during the afternoon, but if possible.
or fall asleep.
Or fall asleep in the afternoon, yeah. But sometimes even just that rest, though, can actually help you feel more rejuvenated. So even I have my kid, I see a lot of kids with ADHD in my clinic, and so I even tell parents to have like quiet time, and they're like, oh, but he won't fall asleep. I'm like, it's okay. Even just have him have quiet time where he just can sit, just relax. Half the time the kids will fall asleep during the quiet time, but I think it's really important to do it. These are great questions. Anything else? I'm enjoying this. Hope you guys are having as much fun as I am. So I mean, this is my last slide. So that's why I'm like, we can do formal Q&A. I know we're at 12:10.
You're fine.
So take-home points, sleep should be a priority, just like I think with any other overall health. And I just feel like more and more, it's fun because I keep seeing more and more postings about it. I feel like we're all as a society recognizing the importance of sleep, considering a holistic approach. So like you mentioned, you're like anxiety, you can't you can tell me to do all these things, but like if we don't address that anxiety component, it's not gonna really work. I agree, you gotta do all of it together. Morning light, I feel like I'm really can't say enough about it. And then just really considering non-pharmacological interventions first. And then if you do meds, use them strategically or judiciously.
What about sleep debt? Can you address that? And let's say you haven't had really great nights of sleep throughout the week, sleeping in on the weekend. That's kind of not recommended, right? Aren't they recommending that you kind of stay to your same sleep schedule?
The way I usually recommend sleep is if you have true sleep debt, the only thing that replaces sleep is sleep. So if you're sleepy, sleep. But you're right. Is it really great that if you go from sleeping on the weekends and the weekdays and you switch back and forth, that's not really thought to be that healthy. So ideally, if you can minimize that, that's better. But if you really have true sleep debt, I always tell people, get the sleep that you need. Try to catch up on that sleep debt, basically. I don't know if that kind of answers your question, but yeah, I always tell people, my philosophy is if you feel sleepy, sleep.
Mm-hmm. How many minutes should you limit the light box if you're going to use a light box?
Oh,
Can you repeat the question?
Oh yeah, sorry. The question was how many minutes should you use the light box in order to get the full effects? I remember reading somewhere of 10 to 15 minutes, I think is at least generally what people recommend. Some people have said as much as 45 minutes, but I think that might be more if you're thinking more of depression or other treatments. But I think for what we're talking about, I think usually 10 to 15 minutes is pretty good. So for instance, when I lived in Portland, I would do it while I was brushing my teeth and getting ready in the morning and just that kind of stuff because there was no sun outside, so I had to, I had to make my own sun. Another question?
Yeah, I was just wondering, is there a connection between ADHD and sleep apnea and sleep debt?
The question was, is there a connection between ADHD, sleep apnea, and sleep debt? So we do know that when you have ADHD, you have an increased risk of having just disturbed sleep, fragmented sleep, trouble falling asleep. And if you have sleep apnea, you actually have then also more risk of having fragmented sleep and decreased sleep. And if you actually have poor sleep, we know that it increases your risk of ADHD. And then if you have more sleep debt, you're more sleepy, that also increases your ADHD symptoms. So sorry if I'm making this really complicated. So I'm so yes, but basically it's if, the way I always tell parents I see, or any patients I see too, is just if you have ADHD, anxiety, insomnia, ADHD, anxiety, autism, all those things can make your sleep worse, and then worse sleep can make all of that worse too. So you can kind of get into this little bit of a cycle, which is why I always tell people addressing both kind of concurrently is important. So high association of ADHD, symptoms and sleep fragmentation, and then sleep apnea can certainly worsen anxiety and ADHD.
And I heard of a study where people who say they don't need sleep and need very little and go to bed late, and then I heard of a study where they took them camping for a month, and those people who said they only needed like 5 hours of sleep ended up sleeping from dark until sunrise.
Yep.
After a while, and I think that's
Yep.
it's just illustrative of what our society is doing to our sleep.
It's totally true, yeah. Because we can, I'm sure a lot of us can function on 5 hours of sleep. We can get our job done. We can take the kids to school. We can do all the things we need to do, but we don't feel great doing it, right? But if you get the opportunity of sleeping more, you realize, you know, it's a lot of times if you're used to sleep deprivation, and then you actually get a good night's sleep, you're like, whoa, that's what this is supposed to feel like? So yeah, I think that's why I say there's short sleepers out there who do only need 6 hours of sleep, but they're very few people. It's a very rare thing.
Is it trained though, like if you've been an insomniac your entire life, is it possible you have just then trained yourself that you're only gonna get 5 or 6 hours?
100%. Yeah, so the question is like, you know, if you've had insomnia for years and years and years and years, have you just like kind of conditioned yourself to believe, well, this is just what I'm gonna get? Absolutely. And that's part of the issue with insomnia is that, again, you're not doing it to yourself, but you're like, well, this is all I'm gonna get. This is it. This is all I need. And so that's why I think if you know, for people who feel like they've had decades of insomnia, I think that's where really going to sleep specialists to get that help is really important. I remember as a fellow, I saw a woman who had been on taking Ambien for 30 years. And because when it first came out, everyone thought, oh, it's great, it's, you know, it's awesome, it works well, not addictive, no problems. And I think now we're finding there's more issues with it. So she was taking, you know, Zolpidem, Ambien for 30 years, and then actually did CBTI and was able to get off of it and felt great. So, but it, you know, took the investment of the time, you know, but it's possible. Yeah?
And is it true that things like Zolpidem or Lorazepam or whatever, those things like block your sleep cycles? They don't allow your proper sleep cycles to happen?
That's a thought. You maybe you've read like, was it Matthew Walker's book? Because I think he talks about this. Yeah, no, it's great. I love that he talks about it, but yeah, so it's not thought to be the same as sleep. It's actually thought to be kind of like you're sedated as opposed to actually true sleep. So that's why it's not thought to really replace sleep because you kind of a different architecture.
And that's with all sleep medications that you're not getting the same quality of sleep?
No, not with all, just because every sleep medication has slightly different mechanisms. So, but the most common ones, so like Lorazepam is just like really sedating you, and like Zolpidem, like the hypnotic drugs, those are also, those ones specifically. There's some different mechanisms that I think are maybe slightly different, that aren't quite as disruptive. I love this.
Okay.
All right, thank you.
Thank you so much, Caroline.
Thank you.
So her presentation will be up on our website, the PowerPoint, and if you come up with any other things that you want to share, I'll throw it out to you all.
All right, thank you for your attention. This was fun. Thank you, everybody.